This is an extract from the Leader podcast by the Evening Standard. The whole thing is available on all major podcast providers.
So we can announce today that the furlough scheme will not be extended for 1 month. It will be extended until the end of March.
Chancellor Rishi Sunak there announcing furlough will go on even longer than expected. He also confirmed it will cover 80% of wages, and the self-employed are getting help too. The next income support grant, which covers up until January, will increase to 80% of average profits, up to £7,500. It comes as England enters lockdown 2 following a spike in coronavirus cases, except in parts of London. New figures show COVID infection numbers are down in 19 out of 32 boroughs. Our Deputy Political Editor Nicholas Cecil is with me. And Nicholas, it's obviously good news, but it's going to lead to some people asking if the city should be going into lockdown at all.
Yes, that's certainly a very good question, and I think people will increasingly be asking that. These figures are very much an early sign. They're very encouraging, but it's certainly not a trend at the moment. And certainly London's Director for Public Health, Professor Kevin Fenton, was this morning urging Londoners not to give up on the battle against COVID. He's saying that Londoners have a history of pulling together in times of need, and it's important that we do the same again to make these weeks really count. So we've got 4 weeks of lockdown. I don't think it's going to be ditched for any reason now. Therefore, it's a chance really to put the virus on the back foot and put London, the capital, to be in a better place before Christmas.
Yeah, in some ways, those figures going down, this is exactly the right time for that. If they're already on their way down, then lockdown could be what keeps coronavirus out.
Yes, and certainly what it appears to be happening is that measures introduced earlier are now having an impact. So we're talking about more people working from home. And previously in the first wave, London was very successful at bringing the number of cases down, and that was partly because many people worked from home. And the Tier 2 measures, which were introduced, admittedly controversially, more than 2 weeks ago, are now probably having an impact as well.
But there is a kind of caveat to this in that the virus does seem to still be spreading among people in the over 60s, and there are more hospitalisations.
Yes, so certainly there's a very big danger here of people trying to get ahead of themselves and thinking it's all over, and it's far from all over. The cases could again rise sharply again. We could see a reversal of the most recent trend, and it's particularly people who are elderly, the over 60s and even older, who are far, far more vulnerable to this disease. The number of over 60s getting the virus is still going up in the capital. Hospitalisations are rising, and that very unfortunately will almost certainly mean more people will die of the disease in coming weeks.
But with lockdown coming in today, although we're seeing all these businesses having to close up, although we're going to be seeing yet another economic impact of this, what these figures show, and if lockdown is as successful as people want it to be, there could very well be a life after COVID, couldn't it?
Yes, certainly. I think that the next few weeks, possibly months, are going to be difficult. But certainly I think there's light at the end of the tunnel now. We've got a very real prospect of a vaccine coming possibly in just a matter of weeks, if not at the start of next year. This vaccine might not be 100% effective, but it will reduce the mortality rate, or that's the expectation, and with better medicines as well, and mass testing, which is being trialled in Liverpool. If that works and goes nationwide, then I think the country could return to a life closer to normal.